glad that you've joined this introductory webinar to explore our upcoming Learning Collaborative on capital expansion for health and housing partnerships. So just a little bit of technology to start. If you have a question, please use the chat button in the lower right-hand corner, and you can send a chat to the host, Rebecca Cortez, and she will help you address any technology issues. If you have a question or you want to provide input, you can chat to all attendees and everyone will be able to see the comment or question that you have. If you are having audio trouble, again, it's good to close out WebEx and relaunch, and you can certainly contact Rebecca if you are having difficulties. The question we often get is, can we get the recording and the follow-up slides? Certainly, we will send that out to everybody, and you'll see how important that is, especially since this is an introductory webinar on our Learning Collaborative, and we want to be able to make sure that everybody is signing up for future sessions. So again, welcome. We're going to be talking about and introducing our Learning Collaborative on capital expansion for health and housing partnerships. And this is being provided to you from both Capital Link and CSH. So first I want you to meet your presenters today, and you will hear from us today as well as in the subsequent sessions. And then we will also bring on other speakers. You can see our photos. And now we'll also start to acquaint you with our voices. I'm Jane Bilger from CSH. And Jonathan?
Good day, everyone. This is Jonathan Chapman with Capital Link. Certainly glad you could join us this afternoon.
Hi, everybody. My name is Noah Fay, and I'm joining you from CSH.
Great.
So before we launch into the webinar, we find it's always very interesting to see where everybody is who's participating on today's webinar. So if the attendees would be willing, please click the annotation arrow on the top left of your screen and use that to show us where you're calling in from. Oh, great. Well, it looks like we are well represented across the states. That's great. So before, again, we launch into the presentation material, now that we know where you are, we're interested to know who you are. So if you would be willing, could you type into this whiteboard or respond on this whiteboard activity? We'll have one here and then several others throughout the presentation. To tell us a little bit about the type of organization that you represent and what type of role have you played or do you anticipate playing in a potential capital expansion project? And for those of you that are struggling with the arrows, you have to click the arrow again on the left and then you'll be able to use a different tool.
This is exactly why we're doing this exercise, because we want people to get the tools down because we're going to have a lot of interaction throughout these series.
Yep. It's great to see that it looks like we're well represented from a pretty diverse group of stakeholders, so this is nice to see.
Okay, well, we'll get this down certainly by the end of today's session. Let me move it on to covering what who we're going to be talking about. Noah, this is you again.
Yeah, thanks. So just briefly, I want to introduce CSH to the group. So CSH is a nationwide nonprofit operating in 26 states with an aim of doing three primary things, which is first and foremost to try to improve the lives of vulnerable people. So people who are maybe experiencing homelessness or cycling through different institutional systems or criminal justice or child welfare systems involved individuals to help improve their overall quality of life. We like to do that by finding strategies to maximize both public and private resources to ensure that what resources we have available are used in the most efficient and productive ways, with the ultimate end goal of helping build strong, healthy, and vibrant communities as best we can.
And for Capital Link, you can see here from the slide that we're just over 20 years old, 501c3, a HRSA National Cooperative Partner. Actually, our organizational structure is very much like a community health center, and that we have PCA and health center directors and leadership on our board. We do receive a grant through HRSA as being one of those partners to provide such triage services as we're participating in today. We do have offices across the country. Certainly want to be there with you and understanding local communities and issues. You can see here that we participated in over $1 billion worth of financing for approximately 218 capital projects. I saw that updated for the end of 2017 just the other day, and it's now $1.1 billion for 225 projects. So we continue that work. And while we were certainly, initially birthed, if you will, around capital planning and financing and continue to provide those services, certainly as community health centers have become much more complex and comprehensive over these 20 years, Capital Link has tried to evolve alongside you. So now we do offer a multitude of different types of services to support that capital planning, which includes strategic planning, operational improvement, various data analytics, along with the learning assistance such as the webinar today.
And as Jonathan mentioned, both CSH and Capital Link are National Cooperative Agreement technical assistance providers under HRSA. And our goals are to increase access for health services, as well as to improve health outcomes and promote health equity. And we do this by providing tools and trainings that are going to help you improve operations and infrastructure to deliver health services, as well as increasing the capacity and partnerships to address the social determinants of health. So on today's webinar, again, this is an introductory webinar. What we're really doing is setting the stage and whetting your appetite for our learning collaborative that's going to go forward. So first, we're going to cover what the topics are, the capital expansion for health and housing partnerships. We're going to talk about what is a learning collaborative, who should participate, what's the right time in your organizational mindset, and what the next steps are. So earlier, we just mentioned social determinants of health, and clearly this is a term that over the last, half a dozen years or so, as well, it has become well ensconced into both our vocabulary as well as our practice. So social determinants of health are the social, economic, and environmental conditions that impact the quality of life and health outcomes, as well as risks for health conditions. And that's language that's taken roughly from the Department of Health and Human Services, Healthy People 2020. And given that we've just entered 2018, we've got a lot of work that we need to be doing to focus on this. Clearly, there are numerous programs and studies that have demonstrated by stabilizing individuals, vulnerable individuals in housing and connecting them to services, you can positively impact health outcomes, and you can achieve cost savings and in some instances, avoiding costs across the systems. So this is the general mindset that we want to keep in mind. So here are the topics that we're going to be covering over our series of sessions. So we want to make sure that just a quick introduction, a learning collaborative is a series of sessions that will include a targeted group of participants who will continue to participate, and you're going to share experiences and explore common topics. We're going to talk in more detail a little later in this webinar. And throughout our series, we're going to cover the range of topics related to capital expansion. It's important here also to clarify that our interpretation of capital expansion is not limited to health center and housing co-location. We also look at different referral models or satellite facilities, and then there might be other models that we're coming up with as we proceed. So I want to make sure that folks aren't thinking that if you're not planning or you're not even thinking about a co-location, this isn't for you. We'll also, the overall goal is of this series is to expand the infrastructure in both the housing and the health sectors to meet the needs, the community needs that are identified. So we're going to cover what are the benefits of this collaboration in capital expansion. We're going to help you, since primarily our audience are the health centers, we're going to help you develop much more of an understanding of the housing market. We're going to look at how to build health partnerships, certainly dig in a lot on capital planning and metrics and what you need to be paying attention to as you are thinking about infrastructure. Clearly, folks, what we hear from you very often is wanting to understand what resources are out there for capital expansion. And because this is a collaboration, we're going to be looking at both the health center resources as well as the housing resources. And then we're going to help talk through what are the general project logistics. So this next series of slides digs in a little bit more on what we mean by each of these categories. So the benefits of the expansion, clearly we all have shared clientele. There's the capacity and potential to leverage resources. How do we increase care coordination since we do have this shared client and remove the reality which is we're often duplicating efforts. We're going to be targeting the improved health outcomes. And I put in other here because we want you to be prepared to provide us. This is definitely a series of sessions that we're going to be listening to you and your feedback and using that to adapt the curriculum as we're going forward. So on the next topic, the housing types, and I mentioned that we're going to talk about housing types. We're going to be talking about the housing market. It's not necessarily our expectation that you all are going to become the housing experts. That's not necessarily the goal. There are housing experts in your community. So the idea is helping you understand how to access those resources and how you can best work and supportive of one another. CSH is the expert organization, and we work to build quality supportive housing around the country, and we're going to help you understand what is quality supportive housing. And I put in here coordinated entry because there are policies that coordinated entry is a mandated system that HUD has put out for communities, and it's taking effect in all communities starting January 23rd. So what does that mean for you in a collaborative project with housing? What does it mean for you as health centers? We've also, CSH has developed a number of tools on how do you build a healthy partnership, understanding the different types of partnerships, and figuring out what role is most appropriate for your organization based on your capacity and your ability to make commitment. You also want to figure out, in this session, we're going to spend time talking about how do you find good partners, and then when you do find a good partner, how do you really make it work? Noah, I think we wanted to talk about partnerships because we're all involved in partnerships already.
Yeah, thanks, Jane. And I think this is going to be a twofold activity. One, to get up to speed on using the whiteboard itself, because our aim with a learning collaborative is really to make this be an interactive process as much as possible. So you're learning from both the presenters, but then also from each other. So if you would, if the attendees would be so kind as to answer these questions in the whiteboard, talking about what strategies or what factors have made past partnerships successful, what lessons have been learned, and both what have been the challenges in terms of partnering with housing providers or other community sectors and stakeholders. So again, for folks, so they know how this works, what you want to do is you want to click the icon on the top left, the brush-looking icon, and then click the letters, the capital A and lowercase a, and that should allow you to type in the whiteboard screen. And if you're stuck on the arrow, you have to unclick the arrow before you can click the next icon. Yeah, I'm seeing a lot about transparency and shared goals, communication being a common theme. It's both a marker of successful partnerships, but also challenging partnerships too. And this is helpful for us as the facilitators to how to inform the content that we would like to include in the ongoing learning collaborative, to see what experiences you may already have and what challenges you may have already tried to overcome.
No, I think we have to, going forward, use bigger whiteboards.
I think we do. That's a good sign. This is what we're looking for. This is great. It looks like we have, just based on the comments around success and challenges, we have a great deal of past experience with partnerships and collaboration. So that's great. That's exciting.
Okay, we're going to take a picture of this and use it for going forward.
Yes, thank you.
Well,
Jonathan, you want to pick up? Yeah.
Absolutely. Thank you. No, thank you, Jan. And Noah, I really do like that whiteboard capacity. That adds quite a bit of interesting feedback and interactivity throughout this. To continue a little bit about the structure and intentions of the Learning Collaborative here, we're taking a look at the capital planning and resources. And certainly this is, again, something that both CSH and Capital Link are quite familiar with from over the years with various projects. And having the ability to walk organizations through, using the data that you have on hand and understanding what those metrics are, how they impact your organizational planning and capacity. Certainly, as we're in this time of data-driven decisions and having to justify decisions ahead of time and being able to evaluate and provide that return on investment, again, knowing what the data points are and what some of those benchmarks you might want to be reaching for, which kind of leads into the operating and financial capacity. With Capital Link's ability to kind of drill down and look at various different capacity issues and indicators across the country and be able to kind of develop some subsets, you can really identify yourself with your peers, not necessarily even within your own state, certainly not a national benchmark would always be applicable. And so understanding what some of those operational and financial capacity indicators are, but then understanding what that gap might be. Is there a real need there? Does your organization, the way it is currently structured, have the capacity to have to take on a new opportunity to expand capacity? Is this something that you would have to identify in a partner? And so really it's almost a little bit of accelerated strategic planning through that process. And certainly once you've identified some of the needs, both met and unmet, you really want to know what those housing capital resources might be. And the whiteboard talked about identifying resources and shared missions and understanding what that capital resource might be. And for those of you that have worked through any sort of capital project, there's usually various options, and depending on your geography, depending on your size, depending on your corporate structure, some of those may or may not be, the epitome of what you're looking for going forward. And so, identifying yourself and knowing what that need is really helps you to identify what those resources are and really enable to formulate and concentrate on those fewer resources and to give the best story going forward. And certainly, again, with health center capital resources, very much similar as the housing resources, knowing what HRSA's intentions might be for you, knowing what your board's intentions might be for you, and kind of sharing that with the community awareness that you have and the community needs that you're trying to reach. So again, this is certainly an iterative process that we want to walk along with you and be able to start from, again, initially identifying your organization's strengths and then walking through there and finding out what those best next steps might be for you. And then once we've identified, certain projects or specific projects that you may want to consider, again, understanding what that financial impact might be. And I know that there's quite a bit of work, and appropriately so, around the value of community health centers and housing projects, wanting to make sure that folks are utilizing their resources and their funding to the utmost. And so knowing what financial impacts might only be to your organization, to your partners, to your patients, to your residents, and certainly to your community is important. So again, we'll kind of walk through some of that structure and how to identify that. We'll also have some resources available for the facility model and site location. Again, walking through, not necessarily a full market assessment, but as you go through and understand your community's needs, you'll have a good idea of the size of the facility that you're looking for, the number of residents that you're trying to reach out to. And certainly that kind of limits the site locations. You may have a great location. You may have a partner that's willing to donate space, and you may have to work within that parameter rather than based on community need. And so it really is a balancing of the identified needs and those identified resources you may have access to. And with all that, if that's not enough, certainly having a work plan and a timeline together. Both CSH and Capital Link have various tools and timelines and calendars that we can help put the project together with. I remember several years ago, I had grown up in the Deep South, and the first construction project I worked with was in Michigan. And it took me a second to realize that, the winter season isn't always the best to break ground in. And so there are certain, geography issues, there's certainly funding issues, operational issues, and other responsibilities, not only as a housing provider, but as a health center, and the things that are coming from our legislators, both on a local and a national level. And so working all this within your organization's timeline certainly is quite important. And again, as we work through this learning collaborative, all of these aspects will be addressed.
So we wanted to give you a couple of examples, and we're going to be using examples throughout the series of sessions that we have. So here's one example. It's called Health Right 360, and it's the 1563 Mission Project. The sponsor is Health Right 360, and they're an FQHC in San Francisco. They focus both on primary health and mental health needs in the community. For this particular project, CSH was involved in providing resources in up to $9 million in the form of the New Markets Tax Credit Program. This is a type of federal tax incentive that encourages private investment in developments that meet a public need. And you're certainly going to be learning more about the New Markets Tax Credit in later sessions. I wanted you to be clear that this particular model is not a co-location model, but Health Right 360 recognized that, up to 80% of their patient base were either homeless or unstably housed, living in unstable housing. And so they recognized the need to reach out to their housing providers, and they've built a very extensive referral network, and they're using satellite facilities on a number of different housing locations. So that's the model that they've really built forward. Another example is Central City Concern, which is in Portland, Oregon. And this model is a co-location, and in fact, it's a co-location, and Central City Concern is an organization that is an FQHC. They provide behavioral and primary health care, but they're also a very strong housing provider in the community. So the project is located, it's on the east side of Portland. It's under construction now. It's going to be a 40,000 square foot FQHC, and it does include medical respite units as well as co-location with targeted units for populations with substance use issues. This, in addition to using New Markets tax credit, it leveraged low-income housing tax credits, which are similar in concept to New Markets, a federal tax credit program, and luckily both are still in our toolkit and didn't get affected significantly by the tax reform bill. But the low-income housing tax credit are focused on developing residential units. And Central City Concern was able to garner the support, very strong support, of up to $20 million from a consortium of local health system partners. So they were able to use certain capital resources and leverage bringing in because of the extensive co-location and ability to identify the market needs in the community. So what is a learning collaborative? I started on this a little bit earlier. So it's a peer forum where we're going to exchange expertise and challenges that are focused on this topic, a given topic. This one is capital development expansion for health and housing. We're going to facilitate the collaboration and the discussions on the topics that we've just covered. In our minds, it's going to be part presentation and very much part participatory. So what the presentations will be informed by ideas that you're providing to us, as well as areas that we anticipate are going to be potential barriers for you. There'll be both this concept of group learning through the series of webinars, and then there'll be individual planning, and I put in parentheses, or in parentheses, their homework. So between our sessions, we're going to have certain templates and work plans that you can be working with and help you further you along in this process of thinking about your development project. Jonathan, you're going to talk a little bit, take this a little bit further.
Sure. Thanks, Jan. And folks, don't let Jan's mention of homework scare you away. No, it's all appropriate. And as we talk a little bit about what the expectations are of the participants, certainly this is to encourage and support you, not to add to your workload. So when we talk about who should participate, I mean, I think folks can see here how many participants we do have on today's webinar, well over 100. And so as we do look for those opportunities to work with health centers and housing providers about these partnerships and with capital expansion and new capital projects, it's really identifying those organizations that already have considered or are in the middle of considering pursuing such a thing. You can see here in the middle, the cohort size, the ideal cohort size is between 15 and 20 health centers. I mean, you can think of this as a classroom. You know, if you have fewer, you begin to limit the experience and the exposure of different types of models and be able to divide into groups and things of that nature. And if you get too much larger, then some folks tend to get lost in the fray. And so I think when we say that we're looking for 15 to 20 health centers, it's those health centers or those organizations, again, that have some awareness of housing, awareness of the housing need in their area. Now, it's not those that are already looking for financing and already have a capital development plan and consultants in place. This really is a learning collaborative to where we're learning about this process. So I think the ideal candidates are those that, they're very serious about pursuing this, but there's a lot of unanswered questions at this point about perhaps who partners should be, perhaps about the financial ability of their organization to take this on, to find out what the long-term costs and impacts are, not only to their organization and partnerships, but again, to their community and their responsibilities to HRSA. So what we're going to do is provide you with an application. And, we'll talk a little bit more about the application in a few moments, but it's not a new access point, I promise. It's a very short, concise, straightforward application that just tries to get at, the basics of the organization, where you are in your thinking process or your planning process, and then we'll be able to kind of rank those based on their ability to participate in this cohort going forward and taking the full advantage of the services that we've mentioned. Now, as far as that's on our side, following that and developing content, and again, the whiteboard was great in providing some insight about what content we may need to further develop through this process. But who on the health center or the housing organization should participate? As Jan went through some of the content and expectations we have of this, there are certain aspects that are financial, certain aspects that are operational, certain aspects that may need, board input and approval. And so what we're asking for is up to 3 individuals from each organization be primary contacts, if you will. And not necessarily all 3 would have to participate in every aspect of the learning collaborative, but it's a sense of awareness. You can consider it, as kind of a microcosm of a planning committee or a project development team. And so those are the things that we're looking for in the participation. Now, I hope I'm speaking for CSH as well, that Capital Link and CSH are also participating and contributing to a couple of other learning collaboratives that also have, some very specific target market groups. So if you feel that this one isn't exactly the one for you, or you feel that the timing is off, there very well may be another learning collaborative that fits your bill. And I think that when we follow up with all the participants from today's website and provide that application, you'll have that contact or that way to communicate back and forth. But again, we certainly encourage everyone on the phone today to think through this and to fill out the application and to consider pursuing this learning collaborative. And next slide. I think Noah's going to give me a little bit of help here. I mentioned about further developing some of the content. We've got here, what are you looking for? If you understand some of the participation expectations we have, what would you, want to receive in return? And again, I think this is the similar process as you've used earlier in the presentation as far as providing comments. Whether it be capital resources, whether it be, I know my health center very well. I don't know what housing expectations or requirements are. I know that Capital Link has worked with a couple of housing authorities that weren't that familiar with health centers. And so they always have to take into consideration what their business model might be. Jane mentioned, the new market tax credits, which Capital Link also, participates in and encourages the use of. And sometimes a lot of those folks that participate in that have to have, if you're going to lease space to housing or housing lease space to health center, you actually have to do a feasibility study on your leasee and your leaser to understand the relationship and the partnership. So certainly market assessment, what have you. And it seems like coordination of those resources, right? I'm sorry, no, I didn't mean to cut you off.
No, I was just going to say, I think, Jonathan, you explained it well, and I can just remind people having a hard time with the tool itself, you want to click in the top left, the pencil icon, and then click the capital A, lowercase a icon if you want to type. And I would just reiterate, based on what we presented today, both around what the structure of the Learning Collaborative will be in terms of a collaborative, interactive learning environment, and then also the content we intend to cover. What are the things that speak to you that you just would like to get out of a session like this? Or what are the things that you have wondered about or have served as kind of big question marks as it relates to capital expansion that you would hope get answered in a collaborative like this?
Absolutely. Thank you for that.
Yeah.
And it does see that we've got a few more diversified, as far as partnerships and really that communication and trust in sharing of information. I think, Jan, you and I had co-presented before in a live session presentation, and that was a great deal of the concern from those folks there as well.
Yeah, and I was thinking back to that session that we did do, the training, and one of the things that came up were that the people in the room, or there were a couple of people in the room that were, you know, maybe the clinical folks or the outreach folks, and they said, you know, but our finance, our CFO, you know, how do we bring them along? And right. So that's going to be something that that I took away from that earlier session, that we really want to make sure that we're speaking to the different members of your team. So on our session that we do on financial resources and financial impact, we're going to make sure that you're bringing those folks to the table to participate in that session.
Right, thanks.
Okay, we will certainly work through the technology tools here, but thank you all for participating.
Absolutely. No, that was some great feedback. Again, I like that whiteboard. I think the folks are going to see that more from us. But as we think about, you know, what is actually how is this going to be structured? How can you expect and plan for this learning collaborative? We've got here what we have tentatively scheduled, the 4 sessions here. You can see here there were virtual sessions as well. You can see here that we've already got some dates set aside. And when we talk about timelines, you can see here that the first one, the fundamentals for health and housing capital expansion, is February 13th. And so that's just a month out. And so we are asking that you're able to turn those applications around relatively quickly, I think within the next 10 to 14 days, and so that we can get back with folks about who's participating in the cohort, the learning collaborative, and, you know, not only offer alternatives for others, but allow folks to plan appropriately depending on what that subject type it is and what type of staff they would like to participate. So again, the February 13th would be another virtual webinar similar to today. And then moving on, we're hoping to have an in-person session while at NACS P&I. You can see here that it's the middle of March. I know that it's Hill visits, and I realize that there's a lot going on, and you will probably be responsible for quite a bit of outreach and advocacy while you're there. But we just wanted to take advantage of folks getting in a room and being able to share that face-to-face. I know as a former participant in Learning Collaboratives, one of the feedback is always, well, if we had a face to a name or if we were able to share in conversations offline, it really does add a great deal of value to the process and does open up some of those doors. You know, earlier in the whiteboard, there was a lot of talk about how to bring partnerships together and structure those, and it's very similar. Being able to, just in a more informal atmosphere and environment, be able to share those needs and those concerns, and quite frankly, being the champions of various ideas and being able to pitch those ideas and walk through various scenarios really does build that collaboration. Assuming that the first 2 follow up, and then we'll have, you know, a month after that, April 10th, the capital planning and financial resources, and then summarizing on May 8th with, you know, how do you connect the planning and logistics together. So you can see here that we do have a typical project timeline and responsibilities kind of in order and want to work through this process. So if you are at the beginning of your own project, you're able to see this is what we need to do first, and have the time and the ability and certainly the encouragement and support that CSH and Capital Link can provide in working through this project along with you. This timeline may seem a little slow for those that have already started planning. It may seem very accelerated for those that haven't yet started planning. And so we'll be cognizant of that going through that. And certainly, you know, we'll be available between these sessions to answer questions and to talk about various aspects. And again, that dangerous word of homework, you can see here that it would be great to have your information on hand as we work through some of these concepts. You can compare to your own organization, and we can have the ability to know where people are in the process and make the most appropriate content and presentation throughout the point. There we go, okay. Again, so next steps, we've got here, complete the application of interest by Tuesday, January 23rd. So again, I think that's just under 2 weeks, but again, having some hand in the development of that application, most, if not all, of that information is already on hand. You could probably pull a great deal of it from other grant applications. It really is, again, just an overview of your organization, who you'd like to participate, and what type of project you are contemplating going forward. It's just a few pages. I think the format that we've set up, that it's an editable PDF, and so there's not like a recreation of a document or anything of that nature. You know, it's not a HRSA application where we're going to, you know, slap a wrist on the number of pages or graphics or anything like that. And while I'm a great fan of the UDS mapper and certainly utilize it a lot in my work, there's no mapping or anything like that as far as attachments going in there. Again, organize your health center team. Again, knowing who should be part of this team going forward. And certainly we recognize that it would be a little different depending on your organization and size and partnerships. You may have a developmental director. You may have an organization where the COO participates in some of it. You may have a clinical director that's, you know, got a construction background, if that's possible. I know Capital Link has one that's an FQHC nurse. They got interested in architectural aspects of the health center, and so now she kind of does play dual roles within our organization. So again, knowing who should represent your organization in the Learning Collaborative and have their buy-in. And then again, participate in those 4 sessions. Again, we're going to make this as engaging and informative and perhaps at times even entertaining. But we certainly would want you to be able to commit to these 4 learning sessions. I don't think that you would receive as much benefit as possible if there were some disconnect or, you know, skipping too much of the material and then skipping ahead in your project and things of that nature. So certainly want to be aware of other schedules and other responsibilities. And again, that's why we think it's good to have at least 3 folks from your organization to kind of tag team this. And then again, to complete those session tasks and questionnaires, you've been great today about responding to the whiteboard, and I really appreciate that. Certainly, again, filling out the application and being able to formulate your project and your project needs and the desires that you have for more content and education. And along those questionnaires will fuel that. We'll certainly respond as close to real time as possible. So the more that you put into it, the more you get out of it. I know that sounds like something our parents all raised us on, but it continues to be true in this case. And then here, when we do pass along the slides, you can see here that there's a link to application. We'll likely attach the application in our follow-up as well. But here the link actually goes to this webinar's website, the registration page, but within that page, it does have a link to the application. So just know that it's 2 clicks instead of 1. So here we've got, you know, additional questions. I think folks have been great about responding to the whiteboard. I see that we've got a couple of questions in the chat. They've actually provided the link there. I appreciate that. That's probably very convenient. Folks can go ahead and get a jump start on that. Again, the recording and the materials will all be recorded. That will provide those materials to all the participants following today's webinar. Certainly, you know, and I know I've talked a little fast. You know, I grew up in the South, and they told me to slow down, and then I talk someplace else, and they say you're not going fast enough. So just having that in mind, I certainly didn't want to gloss over or make light of any aspect that you feel is important. So certainly, you know, add those questions now, or feel free to follow up with Jane or I at a later time.
So we just want to, if there are questions, please click on the chat button and then send it to everyone. I've just got a note from some folks that there were some questions that came in via the Q&A, and so I want to make sure that I'm capturing that. So the first one is this initiative open to FQHCs who thus far are not getting HRSA support for their expansion? Absolutely. Absolutely. Jonathan, you may want to chime in. You have a little bit more about HRSA support, but we want you to understand what it takes to potentially get that support.
Absolutely. No, that's an excellent point, an excellent question, and certainly not. You know, while we certainly recognize HRSA's, you know, funding and contribution to the community health center movement, and your efforts. This does not have to necessarily match up with some HRSA initiative. In fact, I think with HRSA's encouragement, a lot of the national cooperative partners such as Capital Link and CSH are realizing that the more we collaborate, the more resources that we can bring and provide more opportunities to health centers. And so, this doesn't have to weigh in on a HRSA grant or a requirement necessarily. So, and in light, I know we had a lot of capital grants and a lot of guidance and expectations from HRSA a couple of years ago under the Affordable Care Act. This is in lieu of that, right? You've got a little bit more flexibility in the projects and the partners that you may seek out under this learning collaborative. And just while we mentioned that, I did see one question come across talking about a fee to participate, and there is no fee. This is something that the National Cooperative Partners, we do under that agreement we have with HRSA. Certainly both CSH and Capital Link have reached out to community health centers and housing authorities for several years and doing a lot of this work perhaps individually or below the radar. So it's great that we're able to come out in public and join these forces and provide these services for you.
So a couple of other questions that have come in. One person's asking if we don't apply or are not accepted to participate in the Learning Collaborative, may we still view the presentations? I was thinking of that as we were talking, as we were starting to do this presentation. We want to keep the presentations or the sessions themselves, closed, shall we say, to that group, so there's as much interaction between and building of participation of that group. But I think it's a really good idea that we will try to figure out how the materials that are being presented can still be shared with the broader group and get you thinking about it. And quite frankly, we're all thinking about what we're going to be doing next year, and so maybe it'll help prompt you to think about that you'll be ready to do something like this next year. So that's a good question, and we'll figure out how to make sure that's working. I know one person said they weren't able to sign in and you forwarded your information, so we'll make sure that there's the follow-up there. So one person's asking that they manage an affordable housing program and they're hoping to learn more for their program to encourage and get more involved in the concept of addressing social determinants of health. I'm not sure that this learning collaborative is exactly one, it's targeted to the health centers and to bring in the housing providers, but there's certainly a lot of resources that both CSH and Capital Link have available that we can share with you on your target to learn more about about the social determinants of health and how to build partnerships. You'll see in the subsequent slides that we have resources already, a guide to building strategic partnerships and things such as that. So we will be able to move that forward for you, get that for you as well. Jonathan, are you seeing, I don't know if folks are Noah or Jonathan, you seeing other questions?
I saw a question about what individual coaching might look like if you were to participate in the collaborative.
Yeah, that's another one that certainly what we're anticipating at least now is these templates and tools that we will be creating, the quote homework assignments. We would be able to have, provide feedback to you on what you're working on and use the sessions themselves. We haven't worked out the, exact amount of time, but certainly there will be the ability to connect with you and give you that feedback. And as we presented, this is really for you to be building that roadmap, and there's, the capacity to be able to provide that subsequently. So we'll work on it's not a set time that there's 10 hours of assistance. We're going to be figuring that out along the way.
And I'd add one of the ideas that I think we're hoping to really embrace with this learning collaborative is to leverage the experience and past experience and expertise of others that are participating in the collaborative to maximize the amount of time we have together so that informal coaching happens across peers as well as from the presenters themselves.
Absolutely.
Right.
Absolutely.
Right. I couldn't agree more. And again, I say it's unfortunate that we limit the size of the group to 15 to 20, but that's exactly one of the advantages to having such a size, is being able to learn from one's peers.
I think I saw another example, a question that came in: could we invite others to listen into the webinars, for example, potential housing partners? Absolutely. I gave the example of you may not have a financial person on your core team, but they can be participating in the session that's going to be focusing. I think bringing a potential housing partner to participate in a session that has a topic that's appropriate there, and to bring their experience to that would be certainly appropriate and something we would encourage. I think we would provide those cues in anticipation of a next session to say, this is going to be a topic that if you have a partner that you're talking to already, it might be time to bring them in to that. Okay?
Right.
And the one other thing I wanted to mention, we're trying to work on this in-person session, but there's a potential that not everybody's going to be able to be there, so we'll figure out how an in-person session can also be made available to folks, so that if, in fact, you're not able to participate, or not all members of your team are able to participate, that they can still get the content and the materials that are covered there.
Yeah, thank you, Jane. I had meant to mention that during that session and forgot, so I appreciate you following that up.
Someone asked, can we get a copy of today's presentation? Absolutely. A recording of today's presentation, as well as the slides, will be shared to all of those who have registered and participated. And any other questions that you have, you can put them in the chat box, and we'll sort of move along here.
Right. Well, we had mentioned earlier about some of the capital planning resources. I think most folks would be familiar with at least one or two of these, but we certainly want to just point them out at this point. You can see here, if you're looking for more information about federally qualified health centers, we've got here, HRSA, as well as some of the other FQHC partners and lookalikes. We've got the Uniform Data System. For those of you that are FQHCs, you're very familiar with that. For those of you that are not with an FQHC, those health center organizations have to report certain operational and financial indicators to the federal government every year on an annual basis. And the Uniform Data System, a lot of the results and aggregate numbers are provided online. And in one case, the udsmapper.org allows you to thematically map a lot of that and provides a great deal of information around market penetration of the health centers, the types of patients and residents per zip code. So it is a great tool. I would say that, it's certainly become very complex and comprehensive over time. So I've even been able to provide some training to folks around the UDS information and the MAPR system. I know that both of them have tutorials online, but I'm certainly glad to answer any questions. And you'll see here that the link mentions that the year is 2015. Again, this is an annual report. 2016, this link will actually bring you to the latest data, which is 2016. Health centers right now are gathering and reporting on 2017. That usually takes a couple of months to actually work its way through the system and be filtered and cleaned and then made public. And then right here, we've mentioned Capital Link has been for 20 years working with community health centers around capital development. And we've got a number of resources, manuals, toolkits around strategic planning, around benchmarking, around developing a capital project, around board responsibilities throughout a capital development, and things of that nature. So certainly, whether or not you participate in the Learning Collaborative, this is one of those resources that you should at least be aware of. Yeah, and then, you know, we just have a quick overview of the Capital Link products and resources. I mentioned earlier, you know, we've certainly evolved along with the health centers in providing much more than capital development. You can see here that we now, you know, work with folks on financial and operational services, provider productivity, value and impact analysis. I think a lot of folks are familiar with that report. We work with, I want to say 37, 38 states across the country as far as doing annual value reports about how much the health center contributes not only economically but in jobs and patients and things of that nature. And then, you know, I'll notice there was one question, I don't know if we have another slide, talking about the sessions themselves. I think most of the webinars will likely be the same hour to hour and a half. But that session at NAC is yet to be seen. I would envision it would be a few hours, no more than, you know, a half a day. It would be ambitious given all the other activities that are occurring while you're there. So again, my contact information is certainly at the end of the webinar as well as that link. Here we've got some health and housing partnerships that I think Jan is going to walk through.
Sure. I mentioned earlier that CSH has created a strategic guidance or guide for how to build health and housing partnerships. And it has some tools in there, and it really starts with looking internally at your own organization and what's your capacity, what's your interest, and then you do that same comparison looking at potential partners. And then we include documentation of how do you make it work, you know, a memorandum of agreement, defining the roles. Earlier in the whiteboard, a lot of folks talked about what may have worked well or not worked well with their partnerships and communication. So how do you set up good communications to build that trust and confidence that your partner is going to follow through? We also highlight a number of partnership profiles, and these links are available when we send out the slides to you. And then certainly our CSH HRSA technical assistance page has many, many resources for you to look at. I noted the one more question, and we fully appreciate the chat and the questions keep coming in. So somebody asked if the collaborative will review several of the major loan sources along with their pros and cons. Certainly from the housing capital side, we will certainly be addressing that and looking at when they work well together with other resources, what timelines might be, et cetera. And I presume, Jonathan, the same on the health center side.
Absolutely. Yes, ma'am.
Okay. I just want to touch base that CSH hosts a summit every year. It is focused on supportive housing, but we always include a lot of sessions on building partnerships and speaking to our health center and our health system partners. So registration is open, and you can sign on at csh.org/summit18.
Jan, where is that being held this year?
Oh, right there. It's I had put in a slide, the previous slide I had. It's in Los Angeles on June 5th to the 7th.
Right.
Okay. I didn't realize this slide didn't say that. And as Jonathan said, here's our contact information. Pretty easy. Certainly any follow-up questions you have as you think about it, or as you go back to your others in your organization to say, is this something that we want, that we can make a commitment to participate in? As Jonathan mentioned, the sessions themselves will be an hour to an hour and a half, basically once a month with the one in-person one. So we hope it triggers an interest on your part of where your organization is, and it'll certainly be informative for you and for us, because we want to be learning from you of what's working in the community, what are the struggles in the community, and how we can further refine the work we're doing to meet the real needs that are out there. Other questions folks have? We're certainly right on time, if not early, so there is opportunity to answer more questions that you have.
Well, as we begin to wrap it up, I just want to thank you, Jan and Noah, for your collaboration, not only in the Learning Collaborative, but putting this together and being able to offer it to participants. I'm looking forward to working with, quite a unique, diverse group going forward.
Absolutely. Thank you all for your participation. And we'll look forward to your applications. Again, that date is January 23rd, and our goal is to turn that around in just over a week to get back to you. Okay. Thanks very much.
Thanks everybody.